Hey guys, hello. Good evening. So you can tell by the title of the video that I am going to be talking about 5 things that a new medical assistant should never do. Okay. And this is for any medical assistant, really, but I wanted to focus on new medical assistants today because I know a lot of you guys that are watching my channel are brand new to the field. Some of you are still in school, some of you are literally about to enter school. You haven't even entered school yet. I'm actually ran into a young lady the other day in Walmart. She stopped me in Walmart. She recognized me from the channel. And she was just saying how she's thinking about getting into MA school. So I wanted to focus on new MAs. But again, this applies to medical assistants in general. Okay, so let's get into it. For those of you that don't know me, my name is Kendra, aka Miss K. My students gave me the name years ago when I first became a medical assistant instructor in 2011. And I became a medical assistant in 2004. All right, so let's get into it. At the end, for those of you that's joining me live, feel free to ask me questions at the end, but I'm going to just go ahead and get into it. Okay, and of course, there are many things we shouldn't do, right? But let's focus on 5 things. And then also, for those of you that's watching live, feel free to add some things in the chat if you want. For anybody watching the replay, make sure you check in the comment section, replay crew, and you can also add some things as well. All right. So let's get into it. Some simple lessons that every new MA needs before stepping into the clinic. All right. One of the first things I want to talk about is never say I don't know and then leave it there. Okay. Instead say something like, let me find out for you. And the reason why I say this is because, as a medical assistant, you are not expected to know everything. Okay. You will not know everything and you are not expected to know everything. However, you are expected to be resourceful. Okay. So don't guess, don't make up answers. Find the policy. You may have to ask the provider. You may have to get the office manager, ask the lead MA, right? You may have to check the patient's chart, but you should always say, let me find out for you. Never say, I don't know, and just leave the patient there. Okay. Like I said, as a medical assistant, you won't know everything. We are not expected to know everything, right? But you never want to just leave your patient hanging. Okay. Always try to figure out the problem, even if it doesn't have anything to do with you. You know what? Let me see if I can help you find out. Let me see if I can find out for you. Let me see if I can help you. Always offer to help. See how you can, what you can do to find the right person that may have the answer, whether it's the provider, office manager, or another MA, lead MA, or whoever. Okay. So never say I don't know and then just leave it there. Also, another big one, never document something that you did not do. Okay. I remember when I was in school for medical assistant, I remember one of the first things we learned was if it ain't documented, it ain't done. My instructor was a doctor, and our co-instructor, she was a medical assistant. And I remember they always used to say that if it ain't documented, it ain't done. Okay. So always remember that if it's not documented, it did not happen. However, if it's falsely documented, that's even worse. So don't forget to document what you did do. And please do not document something that you did not do. That's even worse because now you're lying. Remember that the chart is a legal document, right? Your documentation is a legal record. So if you did not give an injection, don't chart it. And also don't document before you do something. Okay. So if you're about to, let's just say you're about to give an injection to a patient, or you are about to do whatever. Some people, they have to have it documented before they actually do it. Let's just say you document that you gave the injection in the patient's right arm. You put everything in there into the medical record. And if for some reason the patient says, oh, you know what? I actually want to do this other arm. And then now you don't document that you did the left arm, but actually you're doing the right arm. Or let's just say the patient says at the last minute, you know what? Actually, I realized I don't want to do this. And you document it and it didn't happen. Do not document before you do it. Also, another thing that in one of my phlebotomy videos, someone, they commented, you should label the tubes before drawing your patient. No, you label after you join the patient. You want to label in front of the patient, but after you draw the patient. Again, let's just say you let's just say you label the tubes and then the patient end up not getting their blood drawn. Maybe you couldn't get it. Maybe the patient changed their mind or whatever. Maybe something was wrong with the tube and you had to switch tubes. So now you've labeled that tube and actually didn't draw. But I just want you guys to remember, If it's not documented, it didn't happen. But also do not falsely document. Also, don't document for someone else. Okay. So let's just say you have a coworker, she or he is very busy, and they're like, hey, Kendra, do you mind documenting this injection for me that I gave? Absolutely not. If you did not do it, then you don't document it. Okay. Very, very important. Remember, the chart is a legal record. Okay. Next thing I want to mention, never take a patient's attitude personally. Okay. You can say something like, I understand you're frustrated. Let me see how I can help. This goes back to the first point. Just always see how you can help the patient. Now, of course, there's going to be there may be situations where it's just, it escalates and you do have to get an office manager, or you do even have to get security. That happens. But I mean patients that are just maybe short with you. They have an attitude. One of the things that we have to remember is that a lot of times these patients are scared, they're frustrated, sick, maybe overwhelmed. And, sometimes it's not even about you. And that's not to say that you have to accept disrespect, but you want to stay professional, right? You want to be respectful. You don't want to match patients' energy. And that's actually a certification question. It'll say something like the patient is yelling or irate. And what do? One of the options would be match the patient energy. You never do that. You want to stay calm. You want to stay professional, right? And I've had times where I've had a patient to be short with me in the beginning, and then as they're on their way out, this has happened several times. And they on the way out, what, I'm sorry. It wasn't about you. I'm just tired. I was just scared. I feel better now that I've seen the doctor. So just recognize when it is not personal, when it's just, the patient. And that this goes back to a lesson we talked about, having empathy. Empathy meaning being able to put yourself in a patient's shoes and understand when they're just afraid or sick or, overwhelmed. Again, that doesn't mean we accept disrespect. Okay. I have had a patient that was super disrespectful. It went beyond having an attitude or being scared or afraid. He was outright disrespectful. And I politely excused myself. I said, you know what? I'm just going to go grab the nurse. I'm my nurse manager. And so I grabbed the nurse manager and I let her take over. Okay. Next, never work outside of your scope of practice. Okay. Never. Something you maybe can say to the provider, to the patient. Let me send that question to the provider, or let me go get the provider. Let me see what the provider says, right? If they're asking you questions, remember, as a medical assistant, we cannot advise, we cannot diagnose, interpret results, right? Or make any medication changes or procedure changes or any of that. But we can direct their questions to the provider and then come back and let the patient know what the provider said, right? And also, never work outside of your scope of practice when it comes to certain duties that you may have to fulfill. Make sure you understand what your scope of practice is as a medical assistant, and also in your state. So here in this picture example that I use here, where the she's given an injection. There are some states where medical assistants cannot give injections, cannot give vaccinations. So also know your scope of practice in your city and state. Okay, that's very important, especially brand new medical assistants. Know what you can and cannot do. And don't go outside of that. Don't let patients get you to go outside of that. Even a patient asking something as simple as, I've been having this headache, what should I do? In your mind, you may be thinking, oh, you could just take an Excedrin or just take a Motrin. That will be advising. So resist the temptation to tell the patient, oh, just take a Tylenol. That will be advising. So remember that is outside of your scope. And anytime you are practicing outside of your scope, you are not covered. Okay. You guys know, as medical assistants, you are covered under the physician's license, right? This is only when you're practicing within your scope. So let's just say you make a mistake, you're within your scope, you're covered. This is why providers have malpractice insurance, which also covers the practice as well and their employees. However, if you're acting outside of your scope, you're advising, you're diagnosing, and all of that, you are not, and something happens, guess who's not covered? You're not covered. Okay. So just remember that as well. Brand new medical assistants, understand your scope. Okay. And then let's see, the last thing that I want to say, and of course, like I said, that there's plenty of things, feel free to put them in the chat. But one thing I do want to tell you guys, don't stop learning after you get hired. Always remain teachable. One of the things that I've seen And I have probably been guilty of this myself, just getting comfortable. I want you to always remain teachable. There's always going to be something to learn. I've been in this field for over 20 years, actually. I became a medical assistant in December 2004, and I do not know everything. I became a medical assistant instructor in 2011. There's still a lot of things that I do not know. Always remain teachable, okay? Depending on the type of company you work for, they may have workshops for you guys. I know my company, they have certain electives that we can take. Like I took an EKG class, and mind you, I was already an instructor at this point teaching EKG, but this EKG class went more in depth. And sorry for the noise in the background, guys. You may hear the train going by in my background, so I apologize in advance if you hear it. But this class actually went in more into detail about certain arrhythmias and heart blocks and things that we don't learn as medical assistants. So I took that class, just certain things that we're able to sign up for free. So consider doing that. Of course, this is going to include doing your CEUs, your continuing education units that you're going to have to do anyway. But don't just do it just to keep your certification active, but just stay teachable, stay curious, right? When you get the job, that's not the finish line. Learn the specialty. So as I mentioned, I took an EKG class. I was in cardiology. I wanted to learn even more about the heart, even medications. So learning the medications, the common medications dealing with your specialty. So for an example, working in cardiology, I learned so much about cardiology meds and things like that. And I'm able to recognize certain medications now that I just know, okay, oh, this is a cardiac med, right? This is blood pressure or blood thinner or something like that, right? Learn some insurance basics, learn about, especially if you're working on the administrative side. Just want to remind you guys that because a medical assistant who keeps learning becomes the medical assistant that everyone depends on, right? You just stay teachable. Don't ever think you know everything. I had a student years ago who went on externship. She had already passed her certification, and she went on externship, and she was actually a really good student in the classroom. She actually was going to end up being valedictorian and everything. However, when she went to externship, she got put off a couple different sites. Why? Because she was not teachable. They said she thought she knew everything. They couldn't tell her anything. She kept saying, well, I'm certified and this and that. And so again, even myself as somebody who's been in the field 20 years, I don't know everything. There's still some things my students may ask. And I tell my students on the first day, listen, I'm your instructor. I am not a doctor. I don't know everything. Even the doctors have to go and check some things. You know what I mean? So just stay teachable. Okay. Questions. Drop any questions in the chat. Let me know. Also drop any comments in the chat if you guys want to add. I'm going to look at the comments now. I have a question for you guys. Which one do you think new MAs may struggle with the most? Out of everything I mentioned, which one do you think new MAs, even maybe yourself, may struggle with the most? Okay, so drop your questions in the chats. In the meantime, I want to remind you guys about my MA refresher course. This is for anybody that's preparing for certification. Also, if you've been in the field for a long time, you never got certified, this is for you. I have 12 modules in the refresher course. I teach a lesson. There's that train going by. Sorry, guys. But I teach a lesson in each module. There's quizzes, practice tests, and all of that. There's over 400 practice tests altogether. You can get that at marefreshercourse.com, and it is linked below the video. Make sure you only get one. Do not get both clinical and administrative. Clinical is for people that's taking a clinical medical assistant exam. It includes both clinical and administrative. And then the administrative course is for people that's taking only an administrative course. Okay. So I'm going to go ahead and read your chats now, read your comments in the chat. Again, that's marefreshercourse.com. Make sure you guys, if you're not already subscribed, make sure you do so. Also, you can join my email list as well. That's also below this video in the description. So let me go ahead to these comments. Guys, do me a favor, like the video if you enjoyed this, especially those of you on YouTube. It helps to get the video out there to more people. Sharika says, hey, Miss K from Detroit, a newbie from Detroit. Hey, 313. I asked my instructor, where has she been hiding, Miss K? I love her. Oh, oh, she says very helpful. Love it and ready. Yes, I love that. Hey, Mrs. Creates. Snowflake. Hey, Snowflake. Ebony passed. Congratulations. She passes Saturday. Yes. She says she used my refresher course for studying. See, guys, my refresher course works. I just was mentioning that, marefreshercourse.com, guys. It works. JoJo says, I passed my test. Congratulations. Hey, Mrs. Queen, right? Yep. One Tamar says your provider advice. Yes, absolutely. One Tamar also says it's a lot to learn. Oh, the ear lavages are cool. Oh, yes. I used to do that when I was in family practice. Hey, Miss K, are you still teaching medical administration? So yes, here on YouTube, I do. So for those of you that don't know, I recently relocated from DC to Georgia back in February. So I left my school back in DC. So I'm not currently teaching right now outside of you guys right now. I have to find a school down here, but I am still working. I do prior auth. I'm working on working remote. I work on prior authorizations, but no, I have not found a school down here yet. Eventually I will, but you guys know outside of teaching, I do other things. So I have literally just been focusing on my job and then my business and then also YouTube, of course. So I'm going to eventually find another school, maybe do some part-time teaching. We'll see. Janae, hey Janae. Okay. I received the position for medical support assistant at the VA. The job was supposed to be like however, it's not them. Oh, okay. So someone says they got a job. Yeah, she thought it was for clinical medical assistant, but it's a call center. So I would still take the job. Oh, she said, would you stay if you were lied? Oh, that's different if you're saying you were lied to. So medical support assistant, I will say that's not necessarily a lie, because if you're medical support could be on the administrative side or the clinical side. So I wouldn't say they necessarily lied unless you're saying that they told you you're going to be doing vital signs and, injections and drawing blood, like you're going to be doing clinical work. If they told you that, yeah, that is an outright lie. But if they just did not present that to you in the beginning, that you will be working at a call center, then that's different. So I would say, it just kind of depends on how they presented it. Because I was going to say, take the job, get the experience, and then just be applying in the meantime. It's always easier to find a job, when you have a job, only because you're not as stressed. You're going into the interviews more confident because you already have a job. You're not as, it's not as, it's urgent, but it's not as urgent as when you have nothing and you're depending on this interview to work out. So I would say take it if you can, get the experience and then be applying to other positions. But to answer your question, if I was outright lied to, no, because that's different. If they told you you're going to be doing clinical work and then you don't, that's different. Jayla says, if I buy it, could I have it forever to look? So no, it's only a certain amount of access. So you have 3-month access and you have 6-month access. And that's with any medical. Well, I won't say any, because there probably are some out there that you get forever, but most of the things you buy is going to be, when it comes to medical assistant preparation for the exam, is going to be a certain access for a certain amount of time. Sharika says, I may struggle with never taking a patient's attitude personal. I'm always passionate with helping. I get it. It's hard not to take a patient's attitude personal, especially if you're a caring person, if you're empathetic, because we feel things, right? But just kind of be prepared. I would say, Sharika, and anybody else that may struggle with that, just kind of go in kind of preparing for the fact that it's not about if you encounter patients with attitudes, it's about when you know that it's eventually going to happen, you kind of get prepared for it, and you can just tell yourself, you know what, this is not about me. This patient is feeling away right now. I'm not going to take it personal. I'm going to be professional, and if I have to escalate it, I will, but I won't take this personal, and I definitely will not match their energy. Hey, Maya from New York. Touch base on the prior authorizations. I'm seeing patients request this a lot when refilling prescriptions. Yes, it's the insurance. A lot of insurance companies and a lot of insurance plans, I should say, require prior authorizations. Not all, because 2 patients can have the same insurance, but then one plan may require prior auth, one doesn't. So it's always going to depend on the patient's individual insurance plan, whether they'll need prior authorization or not. But yeah, it's a lot. And I work in cardiology, so we do cardiac meds, and then we do GLP-1s, which are like your Ozempic, Wegovy, Zepbound. No, the person hired me saying that I'll be medical front desk checking the patient's insurance. They never say that it will be a call center. Okay, so they did tell you that it will be front desk, but just not that it will be at a call center. Okay. Yeah, I mean, Mommy Visions on YouTube is asking this question. I would say if it doesn't necessarily sound like that they told you, oh, this is what you're going to be doing, and it's something different. It seems like they did not let you know you'll be at a call center. For me, that wouldn't be necessarily a deal breaker, but it's up to you, whether you want to take it. And I know that was your question, like, would I still take it? I personally would, but I would be applying at the same time. I wouldn't want to stay there for a long time if that's not something you want to do, but I would still take it if they're offering it. And then, like I said, just apply in the meantime. For someone who's visually impaired, I like the automatic blood pressure machines. Yeah. Visually impaired, hearing impaired also. Yeah, those automatic machines are great. What if they always want me to do medical office work too? What if they always want me to do medical MOA work? I'm guessing you mean medical office administrative work too. Gabrielle, it depends. I'm not sure if there was another part to that question. What if they always want me to do MOA work too? Or are you saying maybe like another medical assistant or medical office? You're doing both? It depends. If you're in a private office, you definitely may be doing both. If you're working in a bigger company, a lot of times they have people for everything. They have the clinical medical assistants, they have the administrative medical assistants. So I'm not sure what your question is. Amber says, I got an email for medical assistant job interview, but they didn't reply back to on a time and date. Email them back and just say, hey, I'm just checking back in. I did receive your email, but it did not receive a time and date for an interview. So just email them again and let me know how it goes, Amber. Somebody says, I have a blood draw question. If I find a vein when I palpate, I can't find it again when I'm ready to stick. Sometimes some people tell me to mark it with the corner of the alcohol. I like that method of marking it with the corner of the alcohol wipe. Actually, one of my students, she actually gave us that idea from one of my colleagues. So the phlebotomy instructor at my former school, she was also a phlebotomy student. My old student had also taken phlebotomy, and she said, oh, Professor Hall taught us this to use. I actually like that idea. I think that's a good idea. Look up Mrs. Queen. If you haven't already, go to my YouTube channel and I have a video. It says drawing on difficult patients and marking it and that. So one of the things that I mentioned in the video, some people, they kind of don't like it. But I use the cap to kind of make a mark, there. A lot of people do use that method. Some people don't like it, but it's up to you. That's one of the things you can do. Also, make sure your tourniquet is tight enough. That's a biggie that I noticed. Not patients, but with my students, sometimes the tourniquet wouldn't be tight enough. So make sure the tourniquet is tight enough. Try the alcohol method. And then also look at that video and check out the cap method as well. And congratulations to everybody that has passed their test. And good luck to everybody that's about to take their test. Maya says, I was promised clinical hours for my substance use credentials. It's been 3 months and I have not been able to. So I'm looking. Got you. So the link to the study guide is under the video. It is under the video if that's what you're looking for. Literally nothing. Oh, wow. Oh, yeah. So, yeah. So Mommy Vision is saying nothing they told us. Yeah, that is, if they misled you, that's different, Mommy Visions. It's one thing if they didn't mention something, but if they absolutely misled you, then that means that this company, they send me an email. What company is this, Mommy Vision? Send me an email. You don't have to put it on the chat, but you can send me an email. Yeah, Maya says use the experience and look for another gig while you're there. That's what I was suggesting. But if you're saying they outright misled you about everything, about what you'll be doing, also the pay as well, then yeah, that's another thing. That's up to you if you want to stay. MOA is medical office administration. So that's the administrative side. So the scheduling appointments, possibly even call center, maybe even doing some billing. Someone else says, take it, you may learn something. You'll know when it's time to go. So they're chiming in. in the chat for you, Mommy Visions. They said, Mommy Vision said, thanks all. All right. Okay, guys, I'm not going to stay on here long because I just wanted to go over this lesson and just talk about this with you guys. Maya says inmates do front end and back end work is front end experience. Yeah, that's true. It is. Yeah. From Alabama. Thank you, Maya. Maya says, let's support Miss K and like her video. Thank you, guys. Thank you so much for liking the video. And congratulations again to everybody that has passed their test, and good luck to everybody that is about to take their test. And you guys, I'm about to end this. I wanted to just focus on the 5 things new MAs should never do. Make sure you guys are subscribed and your notifications are on so you are notified when I'm live again. I will be live again this week. Don't worry. I plan to post a lot more than what I was before. I do have more time now. And as you can see, you guys have probably noticed I've been live more than ever because I have more time now. And I told myself I was going to commit to this channel more because I let it fall by the wayside with trying to move and relocating and all of that. But I will be present more, as you guys can see. So make sure you're subscribed, and I will see you guys again sometime this week. Hey guys, some of you have said in the comments, Miss K, how can I thank you? Well, one thing you can do is hit the subscribe button. Many of you are watching the channel, but you are not subscribed. I would love for my subscriber count to match my views on the channel. So if you're not already subscribed, make sure you hit the subscribe button and get back to the video.